these two modules and probably the next one, we will discuss about psoriasis because there are three reasons for discussing psoriasis. I think the first reason is that homeopathy is incredibly efficient in this disease. That's a serious reason. Second is that probably maybe not as a direct reason for consultation, but accompanying other complaints, you have probably a lot of patients with psoriasis. Some of them are not yet with a diagnosis because, for example, the nail psoriasis, which appear very often, not very often, that appear quite frequently in pediatrics, is ignored. It's simply ignored. And the third, so the third reason is that it is a good example of and a good opportunity to make homeopathy again, to learn homeopathy again. The field is absolutely fascinating, and from the beginning, I would like to say that with due regrets, there is no shortcut. There is no shortcut in psoriasis. I would like to show you some tricks, but the real trick is to individualize and to know the remedies there. What is also important is that in psoriasis, repertory are not very useful. There are some rubrics in repertory. You can look at that. I would advise you make an exercise at home. You extract from your repertory all the rubrics of psoriasis, as I'm showing you now. Okay. So I extract the rubrics of psoriasis for you in a very traditional way, skin eruption psoriasis, with 100 remedies as a rubric, and with few other sub-rubrics. For example, in children, you have only 5 remedies, which are not maybe, Staphysagria, yes, is the most important one, but not the other are missing. Then you have, for example, for Staphysagria, for psoriasis inveterata, which is a very bad rubric. Sorry, it's a bad, ugly rubric. Everything comes from Kent, from herring, but after herring, nobody used this name of psoriasis inveterata. It is a proof that herring knew a little bit of medicine, and some others are not using this name. For example, in this rubric, Medorinum is missing. Graphites is missing. Tuya is missing, which are the most important remedies for inveterata. So, when it is about psoriasis syphilitic, please, if you are accustomed with the old way of old notion in medicine, you know that this one is really psoriasis in syphilitic remedies, in syphilitic cases, which is very similar, but the rubric can be used in infected or very very serious cases of psoriasis. What is, for example, missing here, you don't have a rubric for pustulose psoriasis, which is the most serious form of it. Okay, and
What type of psoriasis did you just say?
with the
Pustulate.
pustulose. Pustulose is the only kind of what are the words he's saying after? I don't know what are the words. So pustulose means with pustules, with pus, with pus. It is the most serious form of psoriasis, and it is the only kind of psoriasis that kills people. It's missing. Simple as that. Pustular, okay. Pustular or pustulos, okay. Thank you, Sula. Very, very nice. Thank you. So, what I did, and I would like you to do the same, just to make an exercise with your repertory. Just extract the word, all the rubrics of psoriasis in in your repertory. Yes, it's a good exercise, just a good exercise to make this, you know. And you can put all these rubrics in a repertory chart and look at that. For sure, sulfur and sepia and natrium muriaticum, and these are the first. Anyway, don't count too much on these rubrics. They are bad rubrics. Sorry to say, but they are poor rubrics. Not bad, but very poor rubrics. For example, in palm psoriasis, this is a much better rubric with 23 remedies, most of them coming from Clark. But I think the degrees are not quite correct. For example, in palmar psoriasis, petroleum would be of the third degree, lycopodium maybe at third degree, not phosphorus of third degree, and so on and so forth. So that's the third. That's the introduction. The introduction to the whole idea.